And I would like to start our conversation today with Tonia, if you can answer, what destination can women over 38 consider? Any differences between age limits?
So thanks, Caroline, for the question. Maybe I will introduce myself real quick before that for the people that don't know me. I know there's some familiar names in the chat, so some of you probably do. But yeah, hi, my name is Tonia, and I'm a patient advisor for fertility clinics abroad. And I support patients in the process of finding the right fertility care for them. Most of my patients at the moment are from German-speaking countries. So that is kind of my niche at FCA. I've got a background in rehabilitation and some experience in reproductive health. So I'm very passionate about reproductive rights and inclusivity, and about ensuring that every patient feels supported and understood throughout their fertility journey. And to your questions, which destinations are appropriate for women over 38? So when it comes to European countries, there is really no country where IVF with your own eggs would be restricted. Neither are there any EU legislations that are against that. What does differ is the approach of individual clinics and how they handle the threshold for the age. Some tend to be more conservative and will recommend egg donation sooner than others, because after 35, 40, the success chance with your own eggs does drop, unfortunately, and keeps declining. Which is why many clinics will recommend egg donation, because it's just a medical reality. So, I mean, that said, it's possible to try with your own eggs in many places, and the right clinic will be transparent about your odds and your options as well. It's definitely always worth consulting multiple doctors about your situation, because their opinions and approaches may differ a lot from each other. And ultimately, the final decision does belong to you because it's your body and your treatment. It's also good to remember that egg donation is more profitable for clinics. So recommendations can sometimes be influenced by the business side of things. And if you can, please ask the clinic why it would be recommended in your case. But a good doctor should always act as your medical advisor instead of being a salesperson. So they should explain all accessible options and explain why they would recommend one treatment over the other. But to answer your question finally, some good countries would be Spain, Greece, Northern Cyprus, and the Czech Republic. They're all currently at the top when it comes to options for women over 38, since these clinics do have a lot of experience with patients in that age range, and they tailor their protocols accordingly.
Brilliant. Thank you so much. And if you can summarize just shortly, what kind of age limits are we talking here? In Spain, Czech Republic, the most popular destinations for sure. If you can just tell us this.
So the age limits for IVF with own eggs, they really do differ from clinic to clinic because each one has their own protocol. And everything also depends on your individual medical results. Because every woman is different, every patient is different, and it is very hard to say. But usually, I would say the threshold when it comes to age limits for IVF with own eggs would be around 42, 44 in most clinics. And with donated eggs, that would be up to 55 in some clinics. Usually when it comes to Spain, somewhere around 50.
Brilliant. Thank you so much. And Czech Republic, as I remember, it's 49, right? So this is just a little little bit different. So it's also important to note that. Thank you so much for the first question. Alice, I would like to ask you probably one of my favorite questions. So we receive this kind of question a lot. So what is the best clinic for women over 38?
Thank you, Caroline. Yeah, it's probably also mine and Tonia's favorite question. It's something that we hear probably every day when we speak to patients, and I think it's quite understandable why people ask it, because they want to have the best chance of having a successful treatment, and they want to avoid disappointments. It can feel very vulnerable also seeking medical providers abroad in a country where you've never been before, where you don't know the language, you don't know what to expect. So having that reassurance that you're with the best clinic can be, very comforting. Yeah, so it can feel like a lot of pressure to make the right choice and the best decision. But I believe that there is no universal best clinic for everyone. The same clinic might be an excellent choice for one person, and then not much the needs of someone else. It's not just about the brand of the clinic, how big of a brand they are, or how the statistics they report are. It's more than just that. The results and statistics, you will see they are actually quite comparable between the popular clinics, international clinics across countries. The laboratories they use similar equipment. The doctors, they can all have experience in, for example, IVF with own eggs. So the procedures might be similar, and it's not just about the results. The patient experience across those clinics, it can be vastly different. What I found with my patients is that it helps to reframe this question a little. Maybe instead of seeking for the best clinic objectively, just thinking about what does it mean for you to find the best clinic? What is the best clinic for you? What factors are important for you when you're choosing? So for some people, this might be having the same doctor throughout your treatment, having a clinic staff that is more compassionate in their approach, that don't treat you just as a number, that communicate frequently. Sometimes it's about starting at a date that is convenient to you, so it might be immediate start, for example. Other things you can consider are the language of the staff, whether having a female doctor is important to you, how easy it is for you to travel there. If you've already been to, for example, Spain, and you know the place very well, it might feel more comfortable for you to have treatment there. There's also differences in the logistical support you can expect, psychological or nutritional support that the clinic can provide, and many other factors. So it's important to explore what the best clinic looks like for you. And sometimes one person can feel the most comfortable with a big clinic that has a large volume of patients, because it seems like they're very experienced and you're not an experiment for them. But then another person might actually feel safer with a smaller clinic, which gives them the personalized attention they want. So it's very individual, and I'm sure Tonya experiences that as well. Sometimes people want us to give them the perfect clinic, or maybe choose a clinic for them based on our expertise. And us, we're very happy to help people explore their preferences, offer information about the differences between clinics. But at the end of the day, we encourage people to make this choice themselves and engage with clinics themselves, because it is very personal. And I believe no one can really make the decision for you. It's also quite realistic to expect this process to be more than just comparing the websites or comparing the price lists. You might have to interact with a clinic several times, have a call with their coordinator, get your questions answered, have a consultation with a doctor, learn more about the doctor's experience, see how you feel when you're in a consultation with them. And it's something you can still do remotely. You don't have to travel for that part if that's not available for you. But it gives you some more insight in the type of experience you can expect from that clinic. Yeah, so To summarize, it is very individual, and it's best to, once you have some options shortlisted, to actually reach out and see how comfortable you feel with the staff you're interacting with.
So they agreed on that. So there are many, many aspects you need to look into before you actually make that decision. So thanks a lot, Alice. I think that was very informative for anyone who is looking currently for the clinic. And over to you, Tonya. And again, I'm sure you receive it very, very often. Which clinic has the highest success rates?
So this is actually one of my favorite questions. Alice gets it a lot as well. It's a popular one. And what we do is we do always encourage patients to ask about their individual chances in their case. Because what matters is not actually the clinic's average success rate, but your individual situation. So also, the truth is we don't really know what goes into the published stats. Every clinic does calculate it differently. We don't really know the demographic. And international organizations, they emphasize that clinic success rates aren't really what matters most. It's actually your personalized treatment plan and how much experience your doctor has with cases that are similar to yours. What's also very important is a good experienced embryologist and a good laboratory, which Alice also mentioned earlier. What those stats on the websites mean, they're usually mostly marketing and not really medical data. And we do encourage patients to always look and ask questions. And once your doctor does have all your medical history and all your test exams in front of them, you can ask them during the medical consultation to give you a more accurate estimate for your account.
Brilliant. Thank you so much again. And of course, we do repeat that every now and then whenever we have a webinar, that of course, we will be happy to answer any of your questions. But remember, any doctor needs some thorough medication details from you, right? So this is really, really important as well. Thank you so much. And just to remind everyone that if you have any questions, you can type those in the chat, okay? And in the meantime, we will go ahead with the next question. I would like to ask you, Alice. So what are the first steps a patient needs to do to start the whole process, the whole IVF process?
Yeah. So usually when I work with patients, the first thing we do is we discuss their history, their needs, their priorities. So we do some exploration around what is important for them when it comes to the destination they will be traveling to, or the clinic they want, which factors are the most important ones. Once we have narrowed down the destinations, we can move into shortlisting clinics that meet their criteria. It's good to not have your list be too long because it can get a bit too overwhelming. But what happens once you have a list of clinics you're interested in? So the first step is to get in touch with their coordinators. Coordinators are the staff that will help walk you through the process. At most clinics, I would say you get one assigned coordinator to you. So it's someone that is supposed to know about you a little bit more, someone who will be your contact throughout this process. And the coordinator, at first, they will answer any questions you have. They will tell you more about how the procedure works. And they will probably advise you to get your pre-treatment tests done if you haven't yet. So pre-treatment test is something that is very useful to have before you consult with a doctor. Not all clinics will require you to have this data before you consult, have a medical consultation, but I find that then you can get the most out of the consultation. And the coordinator will give you a list. This list will differ depending on the clinic, differ depending on your age, circumstance, sometimes your history. And that list is, it can be individual. You can get those tests done either in your home country, if that is more convenient to you. You can just find a private provider, most likely, and try to book those in. Or you can travel to the clinic for those tests, whichever is more convenient to you. Once those tests are done, the next step is to consult with the doctor at the clinic. This is most likely going to be the doctor that will be leading your treatment, and this is someone who can break down the procedure for you, explain each step, explain the chances in your case based on your test results, the protocol recommended in your case, in your specific situation. You can also, during this consultation, ask any questions, clarify anything that's not, that you're not sure about. You can ask, for example, like Tonia mentioned, about the success rates in your case. So how many eggs are they expecting to retrieve based on your antral follicular count, your AMH, what success they've had or what results they've had with similar cases, similar patients. What are the fertilization rates when you're using a sperm sample with those parameters? And then how many embryos you can expect, what happens if the first transfer doesn't work out. You can get more questions answered so you can feel a bit more empowered, so you can feel like you have some control over the process or know what is going on to you and throughout this process. So the consultation is for you to develop a clear picture of what's going to happen and what your chances are. You will also learn about how, what medication you will need, how long you have to take it, how soon in advance you have to start planning for the trip, for example. You will also receive a detailed breakdown of the costs of your procedure based on the recommendations of the doctor. And you should get a follow-up after this consultation to your email. Once you have all that information, you're in a right place to think about how you think about taking the next step with this clinic, whether you're happy with the service you got from the doctor, the communication with coordinator so far, whether this is the clinic that feels right for you. Yeah.
Brilliant. Of course, there are many steps. It sounds maybe complicated, but of course, it's doable, right? So thank you so much for just answering this question as well. I do see your questions, so keep them coming, of course, and we will get to those in a minute. Before that, Tonia, again, I would like to ask you, how much time should a woman plan to spend abroad for a full IVF cycle? Yeah.
Thanks for asking. So I wish I could give you, an answer that is a certain number of days, but unfortunately, IVF, as many other treatments, they're not one size fits all. So the answer might depend on your individual case. When it comes to preparing the treatment and all the logistics, we're talking about the entire time span of the treatment. Some clinics do move quicker than others and can do your treatment on short notice in a matter of weeks, maybe even, while others do take their time for example, pre-testing, coordination, and everything might take up to 2-3 months, depending on what kind of testing and treatment you need. When it comes to the stay abroad, most clinics, they recommend around 10 to 14 days for treatment with own eggs. That would be for the end of the stimulation and the egg retrieval. If you're doing a frozen transfer after everything, that might require a second shorter trip. That would be about 2 or 3 days, maybe. And what is important and what we would like to highlight is that, especially for cycles with your own eggs, it's crucial to factor in a little buffer time in your trip before and after, about 1 or 2 days on each end, maybe, because if something gets rescheduled, if your ovulation hits earlier or later than planned, then it's always good to have a bit of a security time frame. Yeah, and as Alice mentioned, pre-testing is also required in some clinics. Most patients actually do it in their home country. That depends whether it's more comfortable for you to travel to the clinic, look around, get accustomed to the space and just do it there, or if you would rather do it at your local doctor's. So sometimes that doesn't require traveling. Same thing with sperm collection. Some clinics advise that your partner travels to the clinic beforehand and gives a sperm sample so it can be analyzed at the clinic. And some clinics do prefer to do treatment with fresh sperm, so there will be no additional trip needed. That does really depend on the clinic and on their individual approach. So there unfortunately isn't one answer for everybody. So overall, I would recommend to always ask your clinic for a rough timeline beforehand, so you can, plan your travel, plan what days you need to take off work, and then you know what exactly you have to expect.
Brilliant, definitely. And again, this is another thing that it's not possible to give a rough, example, right? This is the truth when it comes to the best clinic. It's the same with planning the trip. So how many days you need to stay. Unfortunately, those are the things that you need to look at your own situation. Yeah. Thank you so much. And while I have you here, we do have a question from Joe. Can I still use my own eggs? I'm 43. Any advice you can give here?
That really depends. I wish I could tell you exactly yes or no. I am not qualified to answer that question as I'm not a medical professional. It is best that when you find a clinic that suits your checks, every box of the list of requirements, that you ask your doctor if you have any medical results present. Then they will be able to assess that best. It is very much possible to use your own eggs at 43 in general, but every patient is different. So it's best to check in with a doctor about that.
Definitely something that you need to discuss with your doctor and check your options. But thank you so much, Tonya. And Meg has another question. Alice, if you can answer, can the doctor say clearly what my chances are, or do you have to do the first one? IVF try, yeah.
Okay, so I'm understanding that this is coming from a person that hasn't had any cycles before, but is hoping to get a prognosis from a medical professional. So I would say that doctors have experience with cases, so they can make prognoses based on their experience. They can't make any guarantees because there's a lot of unexpected things that can happen throughout the cycle. Based on the pre-treatment test you have, so how your hormone levels change throughout your menstruation cycle, how your ovarian reserve is, for example, the assessment of your uterus, it will all inform, or even the quality of the sperm that will be used, it will all inform the doctor's prognosis in your case. So once you have all the results, you have all the data, you can still present it to your doctor and you can ask in similar cases when you work with patients with those ovarian reserve parameters, similar age, sperm parameters within the same range. How many eggs were you able to retrieve? How many eggs can I expect to have retrieved with my results? They might not be able to tell you exactly 7, but they can give you a range or tell you what is most likely. And then out of those, let's say 8 eggs, how many do you expect to fertilize correctly? And then out of those, how many do you expect of those embryos to survive until day 5? So this will give you a sort of idea of what you can expect. Then you can ask the doctor how many transfers typically can patients expect. So for example, if the prognosis is 1 embryo or 2 embryos, this means that there's a high chance that you might need a second cycle. just because you might run out of embryos, but it is very individual. It's something you have to discuss with your doctor. And I can imagine different doctors might also have different perspectives on this based on their experience. But yeah, I think it's very good to have those questions noted down somewhere for when you meet with the doctor. Sometimes I find that my patients, when they go to a consultation, they just let the doctor lead, and they feel like they're not in a position to ask about what they're not sure about. And honestly, the doctor is there for you. You need to feel confident with all the information you have. And it's definitely better to ask about your personal chances in depth, rather than just not ask and then maybe feel disappointed with the results if it was much different than, you know, the results you saw on the website, which might be 80% success rate. Yeah.
Brilliant. Yeah, that's a very important thing to remember. Yeah, thank you so much, Alice, for bringing this up. Totally agreed on this. I think that's very important to note and just ask your questions. Indeed. Thank you. And if you can answer one of the questions that, again, I mean, this can be confusing. Different countries, different clinics. So what are the typical costs for one full IVF cycle for women using Onyx, of course, in the countries that we mentioned? Yeah. Sorry, Alice, if you can answer that.
Yeah. So when it comes to costs, it really differs depending on the country. So you will find the cost, for example, in Spain or Portugal is much higher than in other countries like the Czech Republic. And it's something that's important to consider, especially for those patients for whom cost is the main motivation for going abroad. Especially after 38, especially if someone has a low ovarian reserve, you can expect to have multiple cycles in some cases, and that means the costs are going to add up. So overall, you will find that the cost of an IVF package, for example, in Spain and Portugal, the packages will start at about 5,000 euros. They might go up until 6,000 euros, while in Czechia, it will be starting at 3,000. Greece and North Cyprus, they start at 3,500 euros. And this package usually includes the necessary medical procedures for the cycle. Although I think it's still important to ask the clinic exactly what is included and what might not be included. There is almost always additional costs that come into play, and one of them are the pre-treatment tests that we mentioned. If you choose to do them in your home country, you will have to cover the cost yourself. And I know that in some countries like the UK, it can go up into hundreds of pounds even, because the private providers can charge high fees for those tests, especially if you're not doing the full cycle with them. There's other options that you can research. There's self-testing kits at home. You can travel for your pre-treatment test, but it's usually something that you have to pay additionally out of pocket for. Then there's medication, and medication is not typically included in those packages. So yeah, and again, the cost of medication can differ. In the UK, it will be different. In Germany, it will be different. In Czech Republic, it will be different. So some patients choose to buy the medication where they live because this is the most convenient, and some medication you will need 2-3 weeks or even earlier than that before the actual visit at the clinic. Yeah, and also the medication you will be prescribed is different than what other patients might be prescribed. This is also individual, depends on your ovarian reserve, your hormonal profiles, the protocol that the doctor recommends, and it's both the medication before the egg retrieval, after the transfer, or during the process. It will be different depending on a case-by-case basis, and it will cost different depending on where you buy it. There's also travel and accommodation, which you have to add in. And again, very hard to predict this because your clinic might recommend you travel twice, another might recommend you only travel once, and that will affect the overall cost. Yeah, there's some additional things that the clinic might charge you for, but I don't want to overwhelm you with all the information at the moment. Yeah, so as I mentioned, after the first initial medical consultation with a doctor, once you have your treatment protocol, you should get a follow-up email, and that follow-up email should include the cost of each procedure that the doctor recommends in your case, and the additional costs you can expect. While they might not be able to estimate medication, they should let you know about other costs that are expected.
All right. Again, thank you so much. Antonia, if you can tell us, are there any other costs that anyone would need to consider?
Sorry. Definitely, there are other costs. Some of them Alice has already mentioned. So the first one that would be additionally to your treatment is travel costs like flights, accommodation, even local transport, and maybe even unpaid time of work, which you need to factor in. Then come the add-ons like embryoscope, time lapse, embryo glue, assisted hatching. Some clinics do include them in the packages, but others don't. So it's always good to stay informed which ones are included in your treatment. Our colleague Alex likes to say that you have to add around 20 to 30% of the price on top of what you expect. And then 90% of the patients do end up paying extra for something. You might also need to pay for embryo freezing and the storage. That is often included, for example, the first year of storage of your embryos. But then you have to factor in that it's going to be around maybe 300, maybe 500 euros a year for the storage of your embryos. The next thing you might want to consider is, for example, a frozen embryo transfer. If you come back for a second round, that would be somewhere around 1,500 euros, plus the medication costs, especially after the transfer, because the medication doesn't end before the hormonal stimulation, before the egg retrieval, but it's also required to take some kind of medication to uphold your pregnancy and to give your body an extra boost. Those are usually prescribed either by the clinic or by your local gynecologist. So also remember that you have to factor them in. Also, some clinics do charge separately for anesthesia during your treatment. So ask about that as well if you can. And in some cases, you might need to plan for another cycle, maybe. So keep that in mind.
Excellent. Thank you. Thank you so much. And if you can have a look at the question that we've got here from our patients. So what can I do to optimize my body for IVF? I have a stressful job. Do you have any tips to offer?
So I think the most usual tip would be to minimize your stress, which I feel like isn't a very good answer since you have a stressful job as is. So I won't be, preaching to the choir here. But it would be good to do something for yourself as well to bring down those stress levels, to take care of your mind. You can also start to take supplements and just take care of yourself. Watch your diet, your alcohol intake, your nicotine intake, for example.
Brilliant, thank you. And of course, there are plenty of even webinars that we've done in the past that can be also helpful. There are some different methods. Some people prefer to work with some fertility coaches just to help them get through it, let's say. So there is plenty of information, and I can only encourage you to go to myivfenses.com, and there are plenty of events that we did in the past that might be actually helpful. So you can check this out as well. Okay. Thank you so much for your question. And now I would like to ask Alice. There is another question here, and sorry, I missed this for some reason, but I have it here. The clinics require any pre-treatment testing?
Yes, so pre-treatment tests are a routine aspect of the treatment planning. I've already mentioned a bit about that, but they are a very important part. And this is because this gives the doctor the opportunity to make an accurate diagnosis of your case, to screen for any underlying fertility conditions, so you can address them before, as much as possible, before actually starting treatment. So this might allow the doctor to, for example, diagnose conditions like PCOS, endometriosis, sometimes issues with the sperm quality of your partner, for example. So it is a very important part, and it will also inform an individualized treatment plan for you. It will be adapted to maximize your chances specifically based on your hormonal profile and your history, your ovarian reserve, but also help you avoid complications like, for example, overstimulation. So it will all help optimize the plan for you. And the list you will be asked to provide the clinic, it will be very individual, as I mentioned, and it will vary from clinic to clinic. For IVF with Onyx, the most frequently asked for tests are, for example, blood group or blood count, clotting screening. STD testing is very standard across clinics, both for you and your partner. Hormone profiles, especially between day 3 and 5 of your cycle, ultrasound of the uterus, ovarian reserve testing. So this can be checked with AMH or antral follicular count, thyroid hormones, but sometimes also individually you will be recommended to get more tests done. And if you have any doubts about this, get in touch with your coordinator, ask what tests you need to have done, and your doctor as well, if you have contact with them, it might be very helpful. What's important to remember is that the tests need to be up to date. So sometimes having tests from a year ago is not sufficient, depending on the clinic's policy. A lot of clinics will want the test to be done around, maybe not older than 3 months, sometimes not older than 6 months. If they go out of date, the clinic might ask you to repeat them, especially right before the treatment starts, just to make sure all the information they have is up to date. And for the testing, as I mentioned, you can either do it in your home country, you can travel for them, you can research at-home testing kits. There are several options now possible.
Yeah, definitely. Thank you for that. And if you can have a look at the question that we've got right here as well. When I get pregnant, do I have to pay for further medicine myself? Alice, if you can you see it? This is the last question.
Yeah, I can see the question. Yes, so after the transfer, the medicine that you will need to be taking after the transfer, sometimes to sustain the pregnancy, or even once this pregnancy is confirmed, you have to pay for yourself, and it's hard to, it's not usually included in the packages that the clinics offer. It will be an additional cost, and the doctor will inform you in your treatment plan what those medications will be, and it will be your responsibility to organize them. Most likely, you can either buy them at the clinic or you can buy it in your home country, but it will be an additional expense.
Brilliant. Thank you for answering that. And if you have any more questions, go ahead, type those in. We will be slowly finishing, but I still would like to ask Tonia. So this is a very popular topic, PRP, egg rejuvenation, of course, ovarian rejuvenation. We had plenty of events before on this, and I know this is a topic that we receive lots and lots of questions for sure. So should someone consider egg rejuvenation over 38. How does it work? And if you can bring this up a little to us.
Thanks, Caroline. So this is a little bit of a tricky topic because it's very nuanced, as everything considering IVF, but this this topic as well. And we do get frequent questions about it. The thing here is that it's not just about age. It's more about your egg quantity and ovarian reserve. There are actually several types of ovarian rejuvenation, such as PRP, ovarian fragmentation, stem cell approaches. So first off, we would need to know which one we're talking about. Many clinics do offer them, but that doesn't mean, unfortunately, that they're always medically justified. They should be suggested by your doctor only if there's a clear medical reason why they might help you specifically in your case. And as I mentioned, their goal isn't to fix egg quality or to fix egg quality, because most of the techniques won't improve that. In some cases, they might slightly increase the number of eggs that will be retrieved in your treatment. The results are still mixed. Some patients do respond well to that kind of treatment, others don't, and the evidence that we have is still limited. So also some clinics do tend to repeat the procedure multiple times before your treatments in hopes to stimulate or wake up your ovaries. It is very important while making this decision to find a doctor that specializes in this. Ideally, someone that would have a lot of experience with patients in a similar situation to yours, and someone maybe who has some published results on this topic. And they should explain whether it makes medical sense in your case or not. There are, of course, case studies that show promising results for PRP and the likes, but that's for a certain group of patients, and it's definitely not a treatment for everybody.
Definitely, it's still a tricky one, as you've mentioned. I think the most important part here is that it's still not, let's say, fully evaluated. It's still not evidence. There is not enough evidence, right? So this is the issue with that. But thank you so much for bringing this question, and of course for answering that. Tonia, if you can see the question, I'm sure again you receive it very often. Are there particular clinics you would recommend?
So if you would like to speak about clinics, we would need to know a little bit more about your specific situation. So if we can invite you to contact us at patientcare@ivfmedia.org. We can paste that email address in the chat, or there will be a short form to fill out after this webinar, which Caroline is going to explain to you as well at the end. But I cannot, or we cannot recommend clinics without really knowing your specific situation and your expectations, because everybody is different and there is no one size fits all. As Alice mentioned earlier in our webinar, there isn't such a thing as the best clinic for women over 38. So if you want to get in contact with us, we would be happy to chat with you about your options.
Definitely. Thank you so much indeed. And of course, now I think we will move on to our final question for today. I do see another question from here. It looks like, this is a question more for a fertility specialist. What are your thoughts on growth hormone, and how long should it be taken, and how far is the impact of it on the quality and quantity? So I think it's best if that would be answered by a fertility specialist. So we will leave it this, okay? Remember that we have plenty of events with fertility doctors, so I can only suggest to simply join our event, or just simply send this question to us, and we'll be happy to help you out and forward this to the fertility specialist. Okay. Thank you so much. And Alice, finally, I would like to ask you about PGTA, so pre-implantation genetic testing for aneuploidy, and does it improve outcomes in this particular age group? How does it work?
Yeah, this is frequently recommended by many clinics, but not all patients really know what this test is or why it might be helpful. So just to explain a bit more about it, this is a procedure that is used to screen embryos for chromosomal abnormalities. So for any chromosomes that are additional or any that are missing. And it's a procedure that is done after the incubation period, but before the transfer. So this will include taking a small sample of the material and just testing it for the presence of the chromosomes and whether the numbers are correct. And this is because in advanced maternal age, so above the age of 38, the chances of abnormalities when it comes to numbers of chromosomes, they also increase. So with higher age, we have more abnormal embryos. And this means the abnormalities in those chromosomes, they might be associated with things like miscarriages or implantation failure. So this test helps to discriminate which embryos have a higher chance of a successful pregnancy and which ones might have a higher chance of a miscarriage or a pregnancy loss. So this is the aim of the test. And it's not a miracle method. It doesn't help everyone. It's not the best choice for everyone. I would say it is very valuable and beneficial, but for a certain group of patients. And whether you are within that group, it's also best to have it evaluated with a doctor in a way that is also understandable to you. So, for example, the downside of this test is if your embryo tests as abnormal, you can't use it. Which takes away the chance of having a transfer. Whether that transfer would be successful or not, I guess we don't have a way of knowing it. It's just statistics that doctors are using to guide this decision. And I think it's best to just have it individually evaluated. It's usually recommended for patients where there is expected that there will be multiple embryos. Often if there was previous experiences of miscarriage or pregnancy loss, which suggests that there might be a higher number of embryos with abnormalities in their chromosomes, and then it can help you select sort of the embryo with the most optimal transfer for you. But it's not the best option for everyone, and sometimes having a transfer is better than having no transfer. So it's best to discuss it with your medical team. But if you and your doctor decide it's something you want to explore, it's important that you find out what are the cost implications for you and what are the logistical timeline implications for you. This will involve costs of testing, costs of embryo biopsy, potentially cost of embryo freezing, then having a frozen transfer. All of this added up, it can mean potentially doubling the cost of your procedure. So very good to get clarity on that. Another thing is timeline. It takes several weeks usually to get the outcome of this test, which means moving your transfer date potentially by a month or two into the future, away from your egg retrieval date, which will have, consequences for you when it comes to arranging further trips. Yeah, so it's, I guess, a complex topic, and your doctor should be able to, explain it in a way that is specific to your situation.
And as everything in IVF, it has to be personalized. Yes, as Alice and Tonya just been explaining all of this for you. Everything is personalized, and it should be. So we will be finishing, but of course, as Tonya already mentioned, you will be redirected to a website where you can book a consultation with both Tonya and Alice, and of course. We can only encourage you to do that. It's free of charge, so you can just simply ask your questions and find out a little bit more. I think it's always nice to be able to speak to actual person and discuss your options. And the Tonya as well as Alice, I'm sure would be happy to help you out. They are doing this on daily basis, so I'm sure they will be happy to hear from you. And we will be finishing for today, but as always, remember that if you have any questions, you can also get in touch with us directly. And as I mentioned with Tonya and Alice, thank you, Tonya, Alice, for today. Any final words before we finish?
Yes, thank you for having us. Thank you for all your questions. What I wanted to say maybe at the end is that if you have any doubts or any questions about the treatment, you can always ask your coordinator, always ask your doctor. They are there for you. You are the patient, and they should answer all your questions so that you don't, tap in the dark.
Definitely. Alice, anything else?
Yeah, I'm very happy I could be here with you today, and I hope this was useful to some of you. I would say definitely feel free to reach out to me and Tonya. You will have the website details, and we're happy to support you throughout, share any experiences we get from other patients we support, many of whom are already during the treatment or they finished the treatment and they have a lot of useful feedback that can help other people. What I would also add is it sometimes helps to seek support groups, especially in that initial stage when you're just exploring your options. And yeah, it just helps to have a community. So I would encourage you to build your support system within your family, your friends, finding a support group of people also traveling abroad. Even though it might seem like a very lonely experience, there's a lot of people that share it worldwide, and we speak to many of them. So you're definitely not alone.
Thank you both for a very informative session. You can see the thank yous here. And so just let me remind everyone, Tonya and Alice, they are patient advocates at fertility clinics abroad. So you can get in touch with them. And I'm sure they have more details to share with you. So thank you so much, both of you two, for tonight. And of course, I'm really looking forward to some more events. And everyone, thanks a lot and have a lovely evening. Take care. Bye.
Thank you. Bye.